You guys doing? Welcome back to another show of Source of Information. It is always a pleasure to be here with you and to provide you guys with some fantastic information. The type of information that really going to make a big difference in your life, especially when that time comes for retirement. My name is Gilbert Frank, and you could always find me at 954-667-4885, 954-667-4885. Today, we're also taking your call on 305-945-1580, 305-945-5080. We're also on live on WSRF 1580 AM on YouTube. When you go on YouTube, please subscribe. We would like to see that subscribe number continue to go up and up and up and up. And I know that you appreciate the type of information we're providing to you. So let's show it by subscribing on YouTube. And we are actually right now on Facebook Live also. So all my friends from New York, from Jersey, again, you could ask a question while we're live on Facebook, and I will respond to you while we're live. So we're going to try to use all the resources that we have so that we could make this a pleasurable experience for all of you that are participating. Again, the number to call at 305-945-1580, 305-945-1580. Well, let's get started. Without further ado, the topic of the day, what we're going to discuss is the purpose of the reason for you to apply 3 months before you turn 65 for Medicare. You know, when we were little, our parents used to say, do this, do this, do this. But they never give us a reason why we should do it. And so what I'm doing now is basically, instead of me telling you, instead of me telling you to, this is what you should do, and not giving you a reason why to do it, defeat the purpose. So what we want to do now is go over the reason, the purpose for you to do, to apply for those benefits 3 months ahead of time. The main reason is let's backtrack. Now, if you go check on the website, it's going to say 3 months before, 3 months after. Or you may not see that on the website. My logic is this. When they were taking your payment, they took it right away. They didn't say, well, let's forget about it. We'll take it 3 months later. No, it was taken exactly on time. So, and remember, I think the 3 months later come into play so that you got that 3 months extension before they penalize you. But we're not going to concentrate on the negative, the penalty. We're going to concentrate on the positive. The positive is that when you apply 3 months ahead, the goal is on the first day of your effective date, you should have everything in place so that on that very first day, should God forbid that you need to go to the hospital, you need to see a doctor, that all your benefits will be in place. Now, what I'm talking about, all your benefits will be in place, is very simple. Reason number one, once we start that process for you, there's a lot. To process the application, there's a lot of things that comes into play. They may want to do an interview with you, and if they're going to do an interview with you, you got to give them time, and sufficient time for them to process their application, and if there's an interview is necessary for them to have time for them to do the interview, they may actually send some documents like proof of age, proof of status, immigration status. Those are the things that they're going to send. And they normally want you to send original. They don't want you to send a copy. No, they want you to send original. So what you have to do, that originally you have to go to the mail, send it certified mail, make sure that it's signed, and you have to send it a sufficient time for them to receive it, process it, put it in the system so your benefits could start exactly on the first day of the month. Or you could go straight down to the Social Security office and present it in person, and they immediately put it in the system. So you have to do all that within that 3 months period of time, so that your benefit will be effective on the first day of the first day of the month of your birthday month. Okay, so in other words, if you were born in November, for example, your benefits effective date will be November 1st. So on November 1st, you should have already enrolled in a Medicare Advantage plan. If you're eligible to receive, you might be eligible for Medicaid. So that application be already in, so that on the first day, again, everything is ready, and ready to go. Especially for the Medicaid. Now, the process for Medicaid takes about a month. Now, what we're trying to do is get that in as fast as possible, so that the charge for the Part B premium is not taken out of your Social Security benefits. Now, we're going to stay with that part, because there's a different aspect of that. If you're not taking your retirement benefits at 65, if you're waiting for a later date, there's a different process. We'll discuss that a little bit later. But for now, let's stay with assuming that you're going to take your retirement benefits at the age of 65. Now, if we do the Medicaid on time, then before your benefits actually starts, what will happen is that Social Security will write you and let you know that the state's going to pay the premium part B for you. Now, it may differ from state to state. As you know, that Medicaid is a state funded state. It's operated by the states. So that's why you see during the Obamacare situation, certain subsidies that went to the state, and the state was holding it back because they had control of that. So, for example, down here, the states of Florida dictate, like, for if you're not residents of Florida or of the United States for 5 years, you have to be residents for 5 years before you could be eligible for any benefits. Let me backtrack that, okay? For example, if you are a green card holder and you are in your first year of the green card holder, your residence, then you're not going to be eligible to receive benefits from the state of Florida. So you have to be 5 years. So it's after 5 years that you could receive benefits based on the state of Florida's rules and regulation. Now, to continue, so we discussed about the Medicaid aspect of it. There's other benefits that we have to apply for you around the same time we apply for Medicaid for you, which is low-income subsidy. So we have to make sure that is in play also, because if we don't do that by the first, yes, you're going to have Part D, but we have to have you enroll in a Medicare Advantage plan. So with the Medicare Advantage plan, all that have to be done within that period of time, so that on the first you could be effective. But the low-income subsidy is very important because the low-income subsidy is going to help you with your prescription drugs. Now, normally you receive an envelope. It's a 5x7 envelope, and when you pull it, when you pull the information inside of it, you will find an application that says "Help with Prescription Drugs." That application, you have to take your time, fill it out. It's very easy. It's nothing complicated. They ask you about, of course, in the front page, you will see your name, the last four number of your Social Security, the last 4 digit of your Social Security numbers. And I do believe your date of birth is on that application also. So the rest of the information you have to fill out. Information they're going to ask you, income. If you're receiving Social Security or if you're working, what's your income? They're going to ask you information about do you have any stock, bonds, pension plan. You know, all that is trying to get information from you to see whether you will be eligible for low-income subsidies. Low-income subsidy has a higher income threshold. So what I mean by that is when you see, for example, for SSI, for you to be eligible for SSI, your asset cannot exceed $2,000 for an individual. I believe is $3,100 for a couple. No, sorry, $3,000 for a couple. However, for Medicaid, you could have, I believe it's as high as $7,950 in your account as assets for you to be eligible to receive Medicaid. And I believe the amount for a couple is about $15,000 and change. So low-income subsidy itself has for an individual has $21,000, and for a couple, I believe it was $31,000 or $35,000. You know, I could check those numbers and come back at the second half of the show and provide you with the exact numbers. But so we have to do all these things to make sure that by the beginning of your effective date that everything is in place. You're able to get your medication. If once you go to the doctor, they prescribe your medication, you could go to a pharmacy, or in certain cases, certain centers have a dispensary there, which they could provide you with the medication right away, or you could go, or they will deliver it to you. I know at CAMAX Medical Centers, we deliver the medication to you. Let me just, while I'm mentioning CAMAX Medical Centers, this show is sponsored by Clidelia Management Services, LLC, and CAMAX Medical Center, Incorporated. So, having said that, those are the main reason why 3 months before your birthday, you turn 65, that you apply for those benefits. Because if you don't get all these things in place, then your benefit's going to be delayed. And there's nothing worse than having benefits there, potentially, and the mere fact that you didn't apply on time, then those benefits, you cannot take advantage of them. 305-945-1580, 305-945-1580. Let me hear from you. So, now, once we send the application in 3 months ahead of time, you will receive a Medicare card, which is a card, you see, it's white with red and blue stripes. It will have your name on it and some numbers and letters Before they used to have your social security number with a letter A in the back of it, but now they have changed it because to avoid any fraudulent anybody anybody doing any fraud with your information. So that's why they've changed it. So if you were to leave it on the table, somebody happened to pick it up, there's not much they could do with it. Yes, they have your name, and that's about it. They don't have your date of birth. I guess they have no access of getting your date of birth, but they have what they see is a bunch of letters and a few numbers, and that's it. So when you receive that card, the first thing that you should do actually, if you're in South Florida, you call me 954-667-4885, 954-667-4885. But if you're not in South Florida, then what you need to do is, one, is contact your provider if you have one. If you don't have one, then what I suggest you do is whether ask a friend who they're using and get some recommendation. Get a very nice recommendation. And nowadays, there's different ways you could go online and research a particular provider and amount of stars they receive, how long they've been practicing. So that would be one way. So for you guys that's out of the state of Florida, then first choose your provider, because that person, you want to make sure that you choose a great provider and they will continue. You will be, hopefully you will be with that provider for a long time. There's certain things that you might want to look for in a provider. Bedside manners is one, and somebody that you're able to communicate with. A lot of times what we do, especially in the Haitian community, we just pick a doctor just for the sake of picking a doctor. And the person, in many cases, they don't even speak the same language as we do. Or in some cases, I guess is CMS will automatically send you a Medicare Advantage plan card, and with a doctor on there. Without you didn't have the opportunity to pick your doctor. They just pick one for you. So you don't want that to happen. You want to make sure that you pick a doctor, someone that speak your language, or if you're fluent in English, yes. By no means, pick someone that speaks English as long you're able to communicate with the doctor. And again, the bedside manner is extremely important when you pick in a provider. If you pick the provider, then you would I would suggest you go to that provider, call that office, and ask them what type of Medicare Advantage plan do they accept. So they'll give you a list of all the Medicare Advantage plan they accept, and then from there, they probably would be able to provide you the name of a few agents that would come to you and fill out the application for you. Now, once you have your Medicare Advantage plan, they will send you a card with the doctor's name in the back, and now you're ready to for your appointments. Now, there's a few things that are vitally important when you enroll in a Medicare Advantage plan, and when you start for your first appointment. Now, if you're taking any medication, I suggest on your first appointment, make sure you bring all the bottles with you so that the doctor could see exactly what you're taking. And moving forward, they will be able to say, well, whether you're going to remain on this particular medication, whether we're going to make certain adjustment. And for those of you who probably in your 40s or 50s did not have a consultation for a colonoscopy, That's the perfect time. You let the doctors know, and then they'll schedule that for you within the first month of you becoming effective. And there's a lot more that comes into play. With your visit, the doctor will do an EKG, which it's gonna get a picture of your heart, how it's functioning, um, and with the EKG, they'll be able to assess certain things. They'll do labs for you. In the lab, they'll be able to check for um, your glucose level, whether whether you have certain vitamin deficiency. For example, most people in South Florida have vitamin D deficiency. So you want to make sure that's not the case. And if that's the case, then the doctor will very quickly start prescribing you medication to bring it to an acceptable level. For you gentlemen, it's necessary. They will do oh, before we even go to the gentlemen, they will check for cholesterol, your cholesterol level, your glucose level. Um, I went back to cholesterol because that's very important. Earlier, I was looking at a gentleman which is partially paralyzed on his left side, and normally it's due to the fact that your cholesterol level exceeds a certain amount. So what it does is shuts down, and shut down the oxygen that's going to your brain. So we want to make sure that that's monitored, and your doctor will go through all that with you, and you should be able to ask questions. Ask question on what's my cholesterol level. PSA is the blood examination for prostate. So you want to make sure that that's an acceptable level. And all are those things for the guys that you should be asking your doctors to check. I would even said the HIV. It's not costing you anything. You might as well get the test done. So there's HIV. There's well, it'll come back to me. All the tests, all the necessary tests that should be done. You should ask your doctor that to make sure that all the lab work, anything that has to do with labs, the exam that has to do with labs, let's get it out of the way so you know exactly what you're facing with. 305-945-1580, 305-945-1580. We're going to take a quick break. We'll be right back.
Just went on our Carnival cruise. We tried new.
Well, no time for Carnival cruise. Yes, let's get back to the information. So, listen. If I'm making this kind of boring for you guys, I want you guys to let me know. I want it to be excited for you. I want to make sure that you get the information. If there's any information that I just went over, you don't understand, and you have certain I guess if you don't understand any information that I just provide, please call right now, 305-945-1580, or if you want to call in Creole, you can also 305-945-1520, 305-945-1520. We'll be happy to take your call and translate it for all our English listeners, so that we could keep in make sure that everyone is participating. Okay? So again, it's 305-945-1580. Now, once you have everything in working order, then you're good. You may go to your first visit and the doctor said, well, okay, Mr. John Doe, everything is good. We'll see you in 3 months. There's an exam that is extremely important that they will do, which called Um, wow, I am there's a I'm drawing a blank. I'm sorry. Um, there's a particular exam, a lab that they do for your to check your glucose. It usually go back 3 to 6 months, so they could see how the glucose is is in your system, whether it's controlled, and if it's above a certain level, then the doctor will make an adjustment whether you need to just take diabetes pills or whether you will need insulin. Now, I strongly suggest everyone that is listening right now, if you didn't have a good regimen in terms of exercise, you go back and make sure that you stay with that regimen, exercise, and that's one thing that for me personally that I find that when I had the experience a few years ago, I went to the doctor and I was told that my blood pressure is extremely high. I'm borderline diabetes, and immediately I was like, I see what my patients goes through. I don't want to go through the same thing. So I start exercising, and I had a gentleman which we used to go to for CrossFit, and we did that for 3 to 4 years. And till today, I still feel the effect because my blood pressure is controlled. There's no sign of diabetes. Oh, there was cholesterol was through the roof. So now that's under control. So if you haven't not um, get back in the habit of exercising continuously, make that a habit. Okay, and that will be extremely very important for you. I don't like to discuss the medical aspect of it. I like to get someone that a doctor, a professional, to ask them those questions so they could go in much more details with you. But this show, unfortunately, the hour 2 to 3, it's very difficult to get a doctor on board for those hours. So, but we are hopeful in the future we'll have somebody, we'll invite somebody to discuss those items with you. And even if it's pre-recorded, I think we could do a pre-recorded version and bring some of that information to you. Again, it's 305-945-1580, 305-945-1580. In case you were not aware of it, we are live on 15 WSRF 1580 AM on YouTube and Facebook. I'm watching it live on Facebook. I was trying to share it with you guys, but I will do that later, and so that you make sure that every one of you guys are tapped in, getting the information, because if this information could get to you guys and you use it properly, and we're trying to make it so that people in New York, for example, people in Boston, because Medicare is throughout the United States, it operates the same way. Now, the Medicare Advantage plan itself, that requires a little research. I think in the other states they have Medicare Advantage plan, but I don't think it's utilized as well as we do it in South Florida. Okay, we could go to the benefits that they offer here in South Florida. I had a friend recently that came down, and she was telling me for her mom and the what she had to go through, the paperwork to get a hospital bed for her mom. And well, down here, basically, if you have a parents that reach to the point that they need a hospital bed, with the doctors the doctors put in a referral to the insurance company, they will get that hospital bed without a problem. Where I think in the other state you have to go to Medicaid, and Medicaid to put you through a whole process of getting it. That's not the case here. And I'm not. They didn't pay me to promote Florida, last I checked. But I have to tell you, the benefits down here in terms of healthcare is far better than any other places. Although the Medicare Advantage plan, as the platform, Medicare Advantage platform, was created in California. I was reading actually an article recently where how people in California, they had so much payments, different payments for different things. I guess it made it a little bit difficult for them. Here is very straightforward. The Medicare Advantage plan is zero. Let's talk about Medicare. Medicare by itself. Remember, throughout the time that you was working, a portion was taken off your salary to put aside for retirement. So when you get to 65, you'll have this benefits available for you. Now the only thing that they didn't take anything from you for is the Part B premium. The Part B premium, which is $164.90. Actually, right before I got here, I had a call calling regarding that. Now, the Part B premium normally, if you receive an increase, like the way everybody receives an increase throughout the year because of cost of living adjustment, then the premium of the Part B will increase also. Okay. Now that is definitely not the case. Last year, what happened is that we were expecting that to go up to. I would say I was expecting it to be at $220, but instead of increasing it, it was decreased to $164.90. So that was something great that was done by the Biden administration, I believe, because of the level of the inflation. They decided to instead of increase it, decrease it, so that everyone could feel the increase that they were receiving. Last year, this time, inflation was at 9.1%, where right now it's holding at 3%, and hopefully, with the target is 2%, which hopefully we'll get to the 2% before the year end, so things could go back to normalcy. 305-945-1580, 305-945-1580. So, the Part B premium is usually taken directly from your Social Security, even before you receive it. They removed the $164.90, and they send you the difference. Okay. I was having a conversation yesterday with a couple, and they were considering whether to take the Part B or remain with the plan that she has from work. And when I break it down to them, in terms of with the insurance you have from your job, you have a deductible. Normally, the deductible is probably about $1,000 to $1,500. So, to explain to you what a deductible is, the first $1,000 or $1,500 have to come directly from your pocket before the plan could cover you fully. That's why when you go to a doctor's office, you have a copayment of $44. You'll have, and when you go to when you go to a specialist, I went to a neurologist and they had a copayment of $100. And this guy was not my favorite person because normally neurologists, going back from when I was much younger, I found out they weren't doing much for me. Basically, when I go there, they have a conversation, squeeze my hand, let's see the strength in your, push here, and it was more like a talk. And then he said, "Okay, go." So they had a copayment of $100. So when you take all that amount, when you go to a specialist, how much you paying? When your doctor's visit, how much you paying? Your medication, how much you paying for it? And every time you get paid, how much they deduct from you? Excuse me. How much they deduct from you every time you get paid, whether it's bi-weekly or weekly. So when you calculate that whole amount, it comes to if you take all that a month and compare it with what you're paying with Medicare, which is $164.90 only, because with the Medicare Advantage plan, when you go to see a doctor, you don't pay anything for your doctor's visit. Specialist, you don't pay anything for your specialist visit. Okay. Now, most plan probably what they have is probably I've seen $150 if you go to the emergency room and they don't admit you. Now, if they admit you in the hospital, then that $150 you don't have to pay. So that's by far the most I've seen. For some, you may have a certain copayment with prescription drug. Now, prescription drug has improved a great deal. Okay, a lot of people this year did not see any copayment on their prescription drugs. So, and I'm talking about Medicare. I'm not talking about private insurance. I think private insurance, there's still some issues with that. Okay, people with insulin, as you remember last year with the bill that passed, insulin, the highest that you should be paying for insulin, a vial of insulin, is $35. Whereas before it was $100 for you to get a vial of insulin. So a lot of change has done in that, and that's good. That's good. We've heard some different stories about how much people were spending for insulin and what they were doing in rationing their insulin. In other words, they weren't able to take it the way the doctor had prescribed it because they're trying to make it last for the month. So, but yes, prescription drug, you've seen a great, a big difference in it. So, to get back, so you're not paying much for your prescription drug. You may have a $1 or $2 copayment for a prescription drug, and it depends. If you're fully covered by Medicaid and benefits like this, it covers Medicaid cover copayment, co-insurance. So when it comes down to the copayment for a prescription drug, that's covered by Medicaid. Now let's stay right here for a minute. Medicaid is not a bad thing. I don't know why it come to my mind to discuss it. Some of us may, pride comes in, and we going, well, I don't want Medicaid. I don't feel I'm in a position to be receiving Medicaid. But let me tell you, if you are on a fixed income, that income is fixed. So the less that's coming out of it, the better it is. See, that's why I have a lot of people come to me for service, and at the end of the service, they say, well, how much do I owe you? I say, nothing. because I'm very well aware of how much you have, and if a $10 or $5 here and there comes out, make a difference on how you're going to eat, whether you're going to take the be able to pay for that co-payment on a medication. So this is my line of thinking when you sit in front of me. So that's why our service, anything that we do, whether it's filling out the application for food stamp and Medicaid, filling out the application for become a citizenship, replacing your alien card, that we do that for free. Not only that we do it for free at no cost to you, but we find ways where, like a waiver that we could utilize so that you don't have to pay anything. So I know I'm going a bit off the subject that we started, but that's part of the benefits that yes, when you come to me, that you will receive. So getting back to Medicare and your prescription drug. So when you make that comparison, you find out that, what you're spending with your private insurance and what you're spending with Medicare is a huge difference. So that couple that came to me, they were able to, right away after I explained it to them, they were able to make a decision and said, yeah, we'll take the Part B. Listen, it doesn't matter to me one way or the other, because one way or the other, I'm still going to help you. But the final decision, if I provide you with the right information, you'll make a better decision on the direction you should go. 305-945-1580. 305-945-1580. 305-945-1580. 305-945-1580. Call me now. Let me hear your question. Let me hear what you have to say, whether it's a criticism, whether it's compliments, whether it's whatever it may be. We are looking forward to hear from you. Now, I know a lot of my Haitian audience have told me that, well, we don't listen. Either we don't listen or we don't call. We are inviting you to both listen and call. 305-945-1580. 305-945-1580. So, femme tando. So we discussed the real reason why 3 months before you should be already applying, so that in the month that you turn 65, you have everything ready to go and have nothing to worry about. Okay? We went down, we break it down to you, what you in terms of what you will need, or on your first visit to see your doctor, what to expect on the first visit. The first visit usually a difficult one, and usually take a longer time, because the doctor is going to examine you from head to toe and establish a relationship with you, and that will determine whether you will return. If the bedside manner is on point. If the bedside manner is not on point, obviously you're not going to come back. So that's why you need to pick a doctor that will satisfy you, that will take care of you. So since I'm not getting called, I guess there's no questions. But we'll during the week, some of you who may want to get in contact with me could get in contact with me by calling me on my cell, 954-667-4885, 954-667-4885, and I'll be more than happy to take your call and help you in any way that I possibly can. Okay? With the rest of the time that we have, let's discuss some of the calls that I received during the week. And I think it's very informative. We're going to talk about SSI. We have our first call. Hello, you on the air. Hello. Hello. Hello, you on the air. Hello, you on the air. Well, I guess this person Hello, you on the air?
Yes, I would like to know if you uh on 65, 8 months and 66, which one is better? Is the same?
Very good question. No, it's not the same. 65, yes, 65, you have to apply for Medicare. But 66 and 8 months is your full retirement age.
66, 8 months?
Yes. Now, that is if you were born in, I believe, 1958. Now, some people want to wait for full retirement to take their benefits. But Medicare by itself, you have 65. You have to take apply for you have to apply for your Medicare. Now, you ask me which is better. It depends. If you decided, well, I'm not going to take my retirement at 65. I'm going to wait till full retirement. That's your decision. Long term, in terms of what you're getting from the percentage that you're getting is much higher at 66 and 8 months. Okay, I believe it's about roughly about 101%. Whereas I think the percentage for 65 is about 80, 88, something like that. 88%. I don't have the numbers exact here with me right now. But what you could do is decided, well, okay, since I'm not taking it at I'm not taking my retirement at 65. I'm
Mm-hmm.
waiting for full retirement. What you could do is only apply for the Part A and don't
No,
apply for the Part B.
I already applied for A already. So I heard somebody say 66, but you said 65 and 8 months. You could apply for B.
No, 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 no. If you already apply for Part A, just keep it like that. Obviously, you didn't apply for Part B because you didn't want them to take the $164.90. Now you could wait till you get to as long you have a valid insurance from insurance coverage from your whether it's from work or I think to a certain extent even Obamacare, which at 66 you could always prove that yes you had coverage.
Okay.
Okay, so
But
you could prove at 66 and 8 months when you apply yes you had coverage. This is the coverage I had, and then you automatically will get the Part B.
okay. My second question is how much it costs to join medical advantage?
It doesn't cost you nothing for a Medicare Advantage plan. Absolutely zero, zero.
Zero. Okay.
That's the good part about it because not only with the Medicare Advantage plan, not only that you're getting coverage for different all the specialists, basically you're getting coverage from your head to your toes. But they also have what they call added benefits in there.
Mhm.
For example, acupuncture is covered in most of those plans. You get OTC, which is over the counter medication, which once you choose what you want, they send it to your house monthly. Every month for you, you pick exact what you want. They send that to you, whether it's vitamin, whether it's first aid kit, whether it's incontinence. Someone who
Mhm.
want to stop smoking, they have nicotine. I think tablets. I don't know if they have the patch in there, but you have different product to help you stop smoking. So
Okay.
it's a win-win with the Medicare Advantage plan.
So that means that we cover the cost of Medicare. Take a 100 something a month.
Now the $164.90 a month, which is what it is right now. Now, if you're making less than I would say $1,650 a month, then we could apply. We could apply to the state so that the state will pay the $164.90. There's another way that will cover a portion of it for you. I'm not a fan of that. Basically, the plan have what they have a plan called buyback. So the Medicare Advantage plan. Remember when the Medicare Advantage plan give you something on the right hand, they take a good portion of it on the left hand, and partly is because that they have to make a minimum of 3% of profit so that they could maintain their contract with Medicare. So, but when the buyback plan that they offer also have, if you go to the hospital the 5 days, they charge you $150 per day. So that's why I'm not so much a fan of the buyback plans. But the best way is through your Medicare if you're not working, because if you're working, then you're going to exceed, you may exceed the $1,650 a month. But if you're making less than that, yes, we could apply for you so that you could get your Medicare Advantage. I have another call. Thank you for a call.
Okay.
All right,
Thank you.
bye. Hello, you. Okay, we lost that one. It was a very nice question that gentleman just asked there. We covered a lot of things that possibly I was not even thinking about covering. You know, that's one reason I love that when you guys call. Your question is always on point, and you know, right now, especially now where this is going, this is not only staying in South Florida, it's going throughout the United States. And our wish is to get it to the point, yes, where it's widely shared throughout the United States and they could participate getting this information. Because the information we're providing right now, the vast majority of people I'm talking about people that was born here, that have worked throughout their entire life, they don't have that information. You in South Florida, you have it, and now everybody else is going to have it. And we encourage you to share it. Go on Facebook, WSRF 1580 AM on YouTube, and we're on Facebook Live now. You could share it with a friend and make sure they get that information. Well, my time is up. It was a pleasure for me to be here with you guys today. I hope that the information we provided to you will be of use to you. And if you need more clarification regarding any of that, you could always call me at 954-667-4885, 954-667-4885, 954-667-4885. I love you guys. So let's talk to you guys soon. Bye-bye.